Hello, this is Dr. Brian McDonough. The death earlier this week of former Secretary of State and General Colin Powell certainly got a great deal of attention, and I want to talk about several aspects of his death. The one thing it does bring up, though, is a look at numbers. Um, During the course of United States history, there have been 659,227 deaths as a result of our wars. Looking at the numbers, World War II caused the most deaths, 291,557 U.S. lives. The Civil War, 214,938. World War I, 53,402. If you look at our recent wars, the Iraq War, 4,424. The war in Afghanistan, 1,833. But if you look at all these numbers going through the entire history, you will see that we lost 659,267 lives as the result of the horrors of war. If you look at the numbers of COVID-19 in just the last 2 years, we are now up to 733,226 deaths. And if you think it's going away, if you look at just the last 28 days, we've lost 47,978 Americans. And I bring it up for a very important point. You know that across the board, I try to stay apolitical, and I also try to respect those who are vaccine hesitant as well as those who choose to get vaccines and provide information, because if I alienate people, there's no chance of reaching people. I'm not naive. There are some people I will never convince about the importance of vaccines, but I have to keep trying. Just like I keep trying to tell people not to smoke cigarettes, and I keep trying to tell people to wear seatbelts. I do what I can in a public health effort. I hope that desire of mine to try to do that is reflected in an optimistic view or a helpful view. What I want to say, though, is I would almost say outraged due to misinformation as a result of the death of General Powell. Partly because he lived his life to help other people and to serve our country, and then in his death, there were certain people who took his death and said he died and the vaccine could not protect him. In fact, the vaccine is relatively worthless for all of us, and all those different claims. I need to stress something that's really important. First of all, there have been 7,000 deaths that we know of people who have been vaccinated against COVID in the United States. 7,000 over 733,000, but still 7,000. Those people have underlying conditions, serious underlying conditions. One is they may be elderly. Mr. Powell was 84 years old. They can have underlying conditions. Mr. Powell had multiple myeloma. Multiple myeloma is a devastating illness that he was fighting, but it affects the immune system. And yes, the vaccine did not ultimately protect him at age 84 with those conditions. It probably gave him a greater chance, but it ultimately could not save his life. We see that with the flu vaccine. 36,000 people die a year of the flu despite our best intentions. And unfortunately, we can't win every battle against disease. But what's important is not to lose the important message, which is that so many lives have been saved as a result of the vaccine. In addition to that, we know that people who have been vaccinated have less time dealing with the virus in their system. They're able to get rid of it quicker, which means there's less time spreading it. So theoretically, and this is really important, the general may not have contracted COVID if those around him had a higher vaccination rate than the 57% we have in our country right now. I've talked about it before. Take a country like Ireland, because I follow their statistics. They're now 93% vaccinated. And the view in Ireland is certainly one of individualism, but clearly of concern about the community. And I want to say it one more time, and this needs to be stressed. When you look at 733,000 deaths, more than all the deaths in our wars combined, you cannot minimize that number. And if we can increase the vaccination rate, we can dramatically knock that number down. Dramatically knock it down. So you're doing it for yourself, but you're also doing it for others. And my goodness, after all this time, If there were safety profiles and issues, they would be discussed. So please think about others as well as yourself, and think about why you are denying yourself this life-saving opportunity, not just for yourself, but for others.